Terms related to movement. A side where two or more bones come together is known as a joint. Some joints have no movement. Structures of the skull, some have only slight movement. Superior type of foot Euler's joint, and some are freely movable shoulder joints. Flexion is a movement that takes place in a sagittal plane. For example, flexion of the elbow joint approximates the anterior surface of the forearm to the anterior surface of the arm. It is usually an anterior movement, but it is occasionally posterior, and it is the case of the knee joint. Extension means straightening the joint and usually takes place in the posterior direction. Lateral flexion is the movement of the trunk in the coronal plane. Abduction is the movement of a limb away from the midline of the body in the coronal plane. Erection is the movement of a limb toward the body in the coronal plane. In the fingers and toes, abduction is applied to the spreading of these structures, and adduction is applied to the drawing together of these structures. The movements of the thumb, which are a little more complicated, are described on page 50. Body except on these limbs, the palms of the hands, the sides of the fingers, the glans, penis, and clitoris, the labia minora, and the internal surface of the labia majora, and the soles of the sides of the feet and the sides of the toes. Sebaceous glands pose their secretion the sebum onto the shafts of the hairs as they pass up through the necks of the follicles. They are situated on the sloping undersurface of the follicles. They are face of the follicles and lie within the dermis. Sebum is an oily material that helps preserve the flexibility. Clinical skin infections. The nail folds, hair follicles, and sebaceous glands are known sites of entrance into the underlying tissues of pathogenic organisms such as Staphylococcus aureus. Infection occurring between the nail and the nail fold is called a paronychia. Infection of the hair follicle and sebaceous gland is responsible for the common boil. A crumbucle is a staphylococcal infection of the superficial fascia. It is frequently occurs in the nape of the neck and usually starts as an infection of a hair follicle or a group of hair follicles. Sebaceous cyst. A sebaceous cyst is caused by obstruction of the mouth of a sebaceous duct and may be caused by damage from a comb or by infection. It occurs most frequently on the scalp. Shock. A patient who is in a state of shock is pale and exhibits goose flesh as a result of overactivity of the sympathetic system, which causes vasoconstriction of the dermal enterolis and contraction of the erector pili muscles. Skin burns. The depth of a burn determines the method and rate of healing. A partial skin thickness burn heals from the cells of the hair. Fasciae. The fasciae of the body can be divided into two types, superficial and deep, and lie between the skin and the underlying muscles and bones. The superficial fascia or subcutaneous tissue is a mixture of loose areolar and adipose tissue that unites the dermis of the skin and underlying deep fascia. In the scalp, the back of the neck, the palms of the hands, and the soles of the feet, it contains numerous bundles collagen fibers that hold the skin firmly to the deeper structures. In the eyelids, auricle of the ear, penis, and scrotum and clitoris, it is devoid of adipose tissue. The deep fascia is a membranous layer of connective that invests the muscle and other deep structures. In the neck, it forms well-defined layers that may play an important role in determining the path taken by pathogenic organism during the spread of infection. In the thorax, An orgasm abdomen, it is merely a thin film of cellular tissue covering the muscle apneroris.